Thank you very much for joining us. We're excited today on the new venture of launching our podcast, which we named Healthcare Conversations. The purpose of the podcast is to educate people in the industry, discuss healthcare matters, the innovation, the current trends, and we realize also just for our general population to educate them about the industry, about the different disease entities as a neutral party, talk about the industry basically, educate them what the pharmaceutical industry is all about, what the general healthcare industry is all about, what people are doing, available opportunities, growth opportunities for those who are in the industry already, and the innovation that is taking place. We'll be covering topics from clinical research. You will realize that the first 2 episodes, which we've recorded already, are based on clinical research. We want to cover a whole lot of topics. We'll talk to people in regulatory, we'll talk to people in the commercial side of the business, we'll talk to people in market access. Different people will be contacted, and I'm hoping we can count on your support. So to kickstart this journey, we invited Dr. Brenda Kubeka to talk to us about a topic that we all know is at the transformation point at this point in time. Everyone is talking about AI, and AI in healthcare is as important as AI in other industries. So Dr. Kubeka is well known in the industry as an expert, but also she's studying masters in bioethics. So we thought this is important for us to invite her. I hope you'll join me in welcoming her to this podium. This is our podium.
Thank you so much for inviting me. Before I start, disclosures. Okay, I'm 100% human. I don't have a chip, I use my brain, and I own the voice as well. Okay, this is the world we live in now. Okay, how many of you use ChatGPT? Okay, how many of you are using AI every day? Wow, so I'm in the right place. Okay, so I've been asked to talk about AI in healthcare and robotics, but with special focus on ethics. So I am an ethicist, I'm just chasing a paper, you know? Yes, so that I can claim it fully. So I think the most important thing when it comes to South Africa is starting with painting the picture in the context of South Africa. So South Africa, we are the most unequal country in the world. When it comes to income inequality, we have a 2-tiered healthcare system. The private sector, which accounts for more than 64% of the expenditure, whilst it serves about 20% of the population. So this is our context in South Africa. So now, looking at AI, I don't think I have to define it. Most of you are using it already. You understand, what it is. What happened is the pandemic actually accelerated the adoption of innovation, new technology, and accelerated digital transformation in the world, not just in South Africa. So with that, we saw a lot of startups coming up with solutions in the healthcare space, developing solutions without involving the clinicians, without understanding the environment, but that was basically responding to the times. But reality also is that innovation is moving faster than the regulation. In this country, we don't have a legal framework for AI, which is something that I think as health professionals we need to advocate for, and I will highlight the reasons why I think we should actually be doing that. So, looking at AI, AI, artificial intelligence, so it mimics how the human brain works, but we also look at augmented intelligence, which is using AI, but at the same time, humans guiding the implementation of whatever the output is from artificial intelligence. If we look at the benefits of artificial intelligence, in healthcare. Obviously, it's issues around increasing access to care, reducing waiting times, improving the experience of patients, and it has also an opportunity of improving the work life of health professionals. So I'm just going to focus on the care side. We know AI can assist in drug discoveries, accelerate that, etc. But I'm just going to focus on healthcare, as in the care, providing care. So population health, increasing access, and then efficiencies. If we think of robots and how they were used during the pandemic, I mean, robots would go clean the rooms, preventing cross-infections, and robots are being used in other countries where they provide social care to patients and also to elderly people that are not being visited by family in facilities where a robot will actually have a conversation with, in a South African context, Gogo Kulu, so that Gogo feels that, there's social interaction, there's someone that cares and stuff like that. So there's a lot that technology can actually offer in the healthcare space. If you look at the efficiencies, it allows professionals to actually spend more time caring and providing the care to the patients rather than dealing or addressing the biological biological abnormalities or just treating diseases. But it allows, in more time to actually sit down and engage, sit down and provide, patient-centric, human-centric, family-centric kind of care. So those are the benefits that actually can come with AI. So what are the objectives? Why should we be looking at, embrace AI? I've already spoken about efficiencies. So if we think of, increased access to care, better clinical outcomes, we think of AI in the radiology space where AI actually makes, better diagnosis of X-rays and CT scans better than humans. So it means there's, better clinical outcomes, most appropriate care being provided to patients, etc. And then patient experience. AI can reduce waiting times, and waiting times is maybe to be seen by doctors, where it can allocate automatically based on demographics, based on symptoms that have been entered on the system and stuff like that. AI can also assist in resource allocation. For an example, a few states in the US actually implemented a AI tool that allocates kidneys for kidney transplant. But that it had serious backlash, and we'll address what are the risks and issues that we also need to keep in mind when we adopt artificial intelligence. And then AI can also decrease health disparities. I mean, in South Africa, if you think about it, I'm sure all of you are on medical aid. You don't think twice before you go see a specialist, and the GPs are always available, and you don't wait for 6 hours to see a medical practitioner, So AI can also assist. Let's say, if you think of NHI, I cannot see NHI being implemented successfully whenever that happens without being enabled by some automation and AI to ensure that the limited resources actually are accessible and are distributed equitably based on need, not based on who you are and the option that you're on and stuff like that. So AI, with the right rules, can actually assist in bridging the health inequity or disparities that actually exist in the society. So we've spoken about benefits. So the other uses of AI, I've asked how many of you use ChatGPT. It's a chatbot. How they can assist in eliminating waiting times again on the phone calls, and they can be, they can respond to general queries, direct patients, etc. So there are definitely benefits of using generative AI in healthcare. So what challenges do we face in the healthcare space, and some ethical and legal considerations. So I always, take a step back and look at our Constitution. What does it say? What are the values of our Constitution? Issues around equality, inclusivity, etc. So when we adopt AI, and I hope when we agree on the ethical values for AI in South Africa, in all the fields, they will be based on those values that we have in the Constitution. So let's address the first one, bias. So bias, it's based on data, So machine learning, the machine will learn from historical data unless it's prospective, but historical data. So historical data has biases. One, biases based on what people think of certain groups in the country, based on gender stereotypes, etc. So if those biases are not addressed and they are used to inform the algorithms, those biases will actually worsen. Okay. So I'll give an example in the healthcare space. So here we have an AI tool that allocates kidneys. And for people to get access to a kidney transplant, they must have had access to renal dialysis. And they must have been consistent with their sessions of renal dialysis. So if you take the data alone, people who missed appointments will not make it to the list of a transplant. But we need to peel the layers as to why people miss appointments. Are they missing appointments because there is no transport? They can't afford transport because the only center in the Eastern Cape is located in Umtata, so everyone else has to travel to a certain place. So that's why it's important that the data that's being used, it has to be interrogated and checked for biases. And the stereotypes that we have also of other people does have an influence on bias. So these are some of the things that we have to reflect on. So there's, quite a number of studies overseas, and one interesting study in this country. If you have the time, there's a study that talks about the utilization of ICU beds in South Africa during the pandemic, in the public and in the private sector. Very interesting. In the public sector, it actually shows that ICU, white people had more chance of being admitted to ICU than darker-skinned people. In the private sector, it was the other way around, So it's the questions that now we need to start asking. Are we talking about the quality of equipment that is being used? Because the data that comes out of that actually informs decision, If I was speaking to people that manage health services, again, it's look at where you're sourcing your equipment from. Because if you're buying from China, you can't say that Chinese people are biased against us. They test on people that look like them. So for them, it's okay. So these are the questions that now we need to start asking is, where is the data coming from? How was the data collected? And the question is, the data that is used to inform the AI solution, is it similar to the data in your own context or not? And then now it calls for responsible use of AI because it may perpetuate health disparities unintentionally as well. So issues around privacy, most of the solutions that we use currently in South Africa, there are a lot of AI solutions. They're imported. Who owns the data? Where is the data? What are they using it for? Issues around privacy, And these are the questions, If I was talking to people that are in private practice, submitting claims, you need to ask the vendor. What do they do with the data? Do they analyze it? Check your contracts. Because at the end of the day, you have the contract with the patient, but they may use the data for other things. So these are some of the risks that come with the use of AI. And then the other one is, so the biases will be built into the algorithms, and obviously the output will be biased as well. So the lack of transparency. So what happens with AI, because of massive volumes of data, At some point, it automatically generates solutions that you cannot explain, what we call explainability when it comes to AI. Transparency and explainability. Whatever the output is, we must, as a human, you must be able to explain how it got to that. If you can't use it. Because at the end of the day, as someone that is using it or as an implementer of that solution, you're still accountable for those decisions. So you cannot say that we're blaming AI, and stuff like that. Although other countries now are moving at, elevating accountability to the level of the innovators. Because they're saying if they do that, then it forces the innovators to make sure that they include the clinicians in the development and the testing and the deployment of all these AI tools. So this is what we call a black box. So the principles of responsible AI, it's transparency. Where is the data coming from? What data was used to train the algorithms? And also whatever the output is, let's say it recommends that you give drug XYZ, you must be able to explain how it got to that. So that's one. And then two, it's fairness, which is, in the South African context, it's not equal access, but it's equitable access and equitable distribution of care. Taking into account that this is an highly unequal country, so that has an impact on the social determinants of health. So when it comes to AI can drive, at least improve the fairness if we collect the right data and input it with the demographic data that actually matters. Where do people stay? How many are they in the house? Think about it during the pandemic. Maybe even outside of the pandemic, discharging patients home, not even knowing who they stay with. If they are staying with a 12-year-old or they are by themselves and whatever, should the care be delayed, discharge be delayed, or, and planning discharge is also influenced by understanding those demographics, where people stay and who they stay with, because that also has an impact on care and recovery. And then it must be inclusive. So issues around biases, it's building in mechanisms of checking for biases, but it's not a once-off exercise, obviously, continuously, and having that feedback loop that allows for the correction of biases if there are any. And then safety and reliability. Obviously, if you look at the example that I gave about the pulse oximeters, it's about patient safety, and then again, that understanding that biases exist. I would say if you have a brain, you have a bias, but it's building into the system and the mechanisms of identifying biases and managing them, and not once off again, but continuously. And then lastly, it's issues around accountability. I'm thinking today in South Africa, this morning, who can you hold accountable? We don't have a legal framework, So the accountability sits with the end user, who is maybe a nurse, maybe a doctor, or the health system on its own. So that's why we need a legal framework and ethical values to govern, AI in South Africa. Actually, globally, not just in South Africa. So, yeah. Thank you.
Dr. Brenda is prepared to answer questions. If anyone has questions.
Hi, Brenda. This is Noctuna. How can we make sure that AI does influence equally across board? Thanks.
Thank you. I think the main thing, it has to start with the awareness that we all have biases, and biases will influence the algorithms, which has an impact on when you implement AI solutions. what we advocate for, it's the diversity when it comes to decision making, the teams to be diverse, so that, remember, sometimes we sit in our air-conditioned offices and think we know what, let's say, someone from, Honeydew informal settlement actually needs and what their challenges are. So the diversity also assists in elevating voices and also in bringing faces that you'll never see in a boardroom, So that diversity does play a role when it comes to decision making. But people that make decisions also need to be aware of the benefits and also of the risk of artificial intelligence, so that when they make decisions or recommendations, those decisions and recommendations are informed. And also, they are so informed in a way that they are able to ask the right questions when, innovators or others come and sell them solutions. And I always say that as South Africa, and actually in the whole continent, we're struggling with a public health system that is overburdened and under-resourced. That makes us so vulnerable when it comes to anyone selling a solution that says, I know you don't have radiologists, here's a tool. It will be able to report for 6 hospitals in your province in 1 hour. Who wouldn't want that? So what we need to do is to elevate the awareness of, yes, the benefits are there, but there's also risk, and what are the questions that need to be asked, and what needs to be put in the contract to safeguard the health system, and also to safeguard the society as well.
Morning, Dr. Brenda. This is just a follow-up on the question from Noktula, I think. Mm-hmm. Yeah. What I wanted to ask is, there is innovation in AI. And have you guys looked into the economics of AI being, especially in healthcare, like we're in healthcare now, being available to everyone? Everyone deserves to have a data, and for free, if we look at it, especially in schools, clinics, everywhere, public places. That is needed for free for people, even for SMEs, for example. They need data in order for them to survive. But how do you sell the concept of striking the balance between not disadvantaging the innovators, but also not disadvantaging the end users in terms of the cost of AI in healthcare?
I'm a strong believer that access to the internet is an equalizer, because if you are a matriculant from Sobantu High School with the most terrible math teacher in the country, if you have data, you can have a teacher from YouTube, So I hope at some point we get to a level where access to the internet is a human right in this country.
Just wanted to ask a question around transparency. Because as you say, the data that is used to train the algorithm, do you see it in the future being maybe put through a process similar to what drug companies have to go through to prove the efficacy of the medication? Do you think a similar process be followed for the AI as well? Because I think if what you put in there is what comes out, it's important that the same process is followed. I'm not sure what the process is at the moment.
Thank you so much for that question. Thank you for the question. Actually, that's what is being recommended. That we follow the same process as you do with clinical trials, etc., making sure that, uphold human rights and the standards are clear, people are made accountable, vulnerable people, they don't know any better, they are protected, etc., etc. So that is what is being recommended,
Thank you, Doctor. I think the lady has touched on Poppy Act.
Yes.
I think there's elements, or the government has a platform to do it. I mean, the way they drove Poppy Act and forcing companies to really comply and make sure that that happens. Why don't we look at something like that to really drive the data where it's coming from, regulate it, and see if we can bridge the gap. So is it possible, or is it something that is far-fetched? Because we also think of systems that we have in the healthcare industry, like your pharmacovigilance trainings that are really compliance issues that you need to do. If you don't do them, that you lose your license in some instances. So I think, is there some disconnect in a way?
I think even if you look at POPIA, there's quite a number of violations that are currently happening. But as long as we're keeping quiet about it, and we are not elevating complaining, especially as the middle class, and also the need for civic society. I'm happy that now we have a South African AI society. So at least if we have those structures that are also keeping the government accountable, things can actually move forward. Because as an individual, there's not much that you can do to shift the system. But as a collective, yes, we can. But we should not keep quiet. That's all that I'm trying to say.
Okay, thank you very much. Oh wow, this was enlightening, amazing. I think we'll give it a